Well, welcome to our program. Today we're going to discuss terror, but in a different form, in the healthcare industry. And with us is Dr. Gil Mileikowsky, and Gil is a specialist. He's also very involved in infertility.
Correct.
Which, because we could just say you're a gynecologist, but this way you have a specialty within a specialty.
Correct. It's called reproductive endocrinology.
In a burgeoning field in the last 2 or 3 decades, right?
Tremendous.
Well, you're on a crusade.
Yes.
We talked about terror in the medical profession, in the industry, in the health industry.
Yes.
Who are the culprits?
The masterminds and the engineers and orchestrators are the corporate attorneys that have the skills to permeate the system from A to Z, all the way from the bottom of a hospital by influencing and writing bylaws of articles of hospitals, all the way up to Congress or legislators of different states or medical boards, and literally have their language dictate what's going to happen. But they do it in a corporate mind. They do it for someone in a system that is also traumatized by liability lawsuits. And so you have knee-jerk reactions and short visions. People don't look at the big picture. Everybody look at his or her own plate. And this is what is lacking. And this is how we have come to a total disaster. We literally have today what some characterize as a healthcare holocaust. 6 million patients died in the last 30 years in the United States, not from their disease, but from errors and complications. Could have been avoided. This is the tragedy. Those are all preventable errors and complications.
Well, how do we prevent it? What's the recourse? What is it that you suggest we do?
Well, it's an excellent question. You see, if you're a farmer and you have hens that you need to watch, are you going to choose a German Shepherd, a wolf, or a fox? Obviously, you'll use a German Shepherd, or an animal that is friendly and will protect the chicken and the hen. The law is totally unreasonable in its expectations. It's not because you write a law that necessarily humans' behavior is going to change. And the failure of the law is to actually have put in the hands of the foxes the responsibility of the control of delivery of care. And so what we have is a contrarian alignment of interests. Those who benefit the most economically from errors and complications are also those who are controlling the means to reduce errors and complications. And so we need to change the law. We have a wonderful model in the United States. You have big debates right now, been many years brewing and growing, between single-payer solution and a consumer-driven healthcare system.
A single payer? Payer, okay.
Have a little accent.
No, but I mean, it's basically, give us an example of a single payer. Would this be an insurance company?
No. Single payer is what is called in the United States any government-provided healthcare. It can be the Veterans Administration, the county, the state, the city, the prison, anywhere where basically the patient doesn't pay. Or if the patient pays, it's a very little or anything. You see, some people would call it a communist system, but it's not a good word in the United States.
Or nationalized medicine.
Nationalized medicine, right. The second system, economic system we have in the United States is sort of a socialist system, which is the HMO, capitated rate. More familiar system is Kaiser, is similar. Then you have what is called the private sector, where the services is called fee for service. Strangely enough, each one of those systems has a built-in incentive to profit one way or another from errors and negligence. And so what we lack is the equivalent of the safety system that exists in the airline industry. What makes the airline industry in the United States so safe, safer than driving your car or a train or any other modes of transportation, is three legs. Number one, you have a black box that gives you a scientific, unbiased, impartial, non-conflicted diagnosis. Why did the plane crash? But this is not enough. That information is then provided to a federal agency that has jurisdiction over every aspect of the airline industry, whether it's the pilot error, maybe the manufacturer's problem, a flight attendant or a mechanist, or management. We don't have an FAA in the healthcare industry, and we don't have, like airline industry does have through NASA, a means to collect anonymous information that could tell us what's going wrong. Once we establish those three legs in the healthcare industry, you'll see how safe it can be.